So Dr. Rosenberg asked me to talk about how PANS may be relevant for other psychiatric disorders and presentations, and I'm going to very briefly kind of give an overview of the various connections that I see in that arena. So the paths to the psychiatric immune interface, there's probably more, but I'm going to focus on about 5 categories. First, inflammation and cytokines. What we know in our society is that there are increasing rates of immune regulatory disorders, inflammation, autoimmunity, allergies, and so forth. So I think it's not unreasonable to propose that maybe psychiatric disorders may show the similar increase due to the same types of causes, inflammation, autoimmunity, and infections. There's been a lot of literature, and it seems to get a lot more publicity sometimes than PANDAS does, of various neuropsychiatric disorders having inflammatory components. There's been a report of abnormal cytokine presentations in autism spectrum disorders and schizophrenia. There's a meeting that Dr. Sweeto and I were recently at. There was a lot of hype about elevated C-reactive protein in depression, so implying that depression is an inflammatory condition. And I think if we can understand this connection between the brain, behavior, and the immune system better, I think we can find better targeted therapies. So everybody that's gotten the flu, especially, or any kind of infection, there's a kind of a phenomenon called sickness behavior. You're particularly lethargic, you're grouchy, you don't want to eat, you're sort of listless, you don't concentrate well. So these are really common things that I think most people can identify with. And this is largely driven by the cytokines released during that infection. However, we know that most infections don't cause compulsions, obsessions, chorea, tics, severe mood lability, urinary symptoms, that's frequent urination and enuresis, and fine motor skill change and dysgraphia. So this is where I think we've heard a lot about the autoimmunity, and I'm just going to kind of briefly touch on it. Dr. Sweeto covered that so elegantly. But what we know is there's the model of molecular mimicry. And PANDAS, Sinihem's chorea, rheumatic fever, and the way the antibodies react to the heart, those are all very kind of classic presentations of molecular mimicry type of autoimmunity. And what happens is that the antibodies that are forming against the group A strep sort of mistaken the body as its target, and it targets the neurons or receptors. And one of the ideas is that you can have antibodies that stimulate the receptors and therefore increase release of neurochemicals such as dopamine, and thereby leading to the symptoms that we see in these disorders of basal ganglia disorders like chorea, OCD, tics, and so forth. And so one of the things I wanted to point out that I think is really interesting is that there is a lot of overlap in Sinihem's chorea, OCD, and tics, and Dr. Sweeto's talked about some of the shared symptoms that these disorders have. But one of the things that's interesting is that Sinihem's chorea, OCD, and tics, and we're not even talking about PANDAS, that the peak onset is between 5 and 12, and this is actually when strep infections are very common in children. It's between 5 and 12. I don't think that's just a coincidence. There's a lot of overlap in the motor and behavioral presentation, as Dr. Sweeto had pointed out. The basal ganglia is affected in all these illnesses. There's a familial risk in all these illnesses. We know that OCD can fluctuate early in illness, even with people that have regular OCD. And so it's conceivable that a lot of the other types of OCD might be infection triggered as well. And one of the things that's been interesting is that premorbid ADHD seems to increase the risk of developing OCD, tics, and Sinihem's chorea. The way they're different in the areas that we really need to sort of sort out why they're different is Sinihem's chorea seems to remit in most individuals, where a lot of people with OCD and tics and pandas, it is a episodic course, relapsing, remitting, that can take a course of several years. But it is interesting that there is a transient tic disorder that remits in 80% of the cases, and in that way it is like Sydenham's chorea. We have not found carditis or tics in these children presenting with PANS and pandas, so that way it's different. The way that we're really struggling is that prophylactic antibiotics are sanctioned in Sydenham's chorea, but not are yet, as of yet, for pandas. And for pandas, there's less of a delay between the infection and the onset of the presentation compared to Sydenham's chorea, where the delay is typically a lot longer. So we know there's a lot of different comorbidity of a PANS-pandas case, but would there be reason to argue that maybe other illnesses can be triggered by group A strep, or certainly by other infections? Stuttering, I did a study of men with a stuttering disorder. It was a pharmacologic study, but I always liked taking the history, and it was interesting how often these men would describe chronic strep as young children. And there's also been case reports of stuttering caused by strep. Trichotillomania, I've seen cases of this, and I'm not sure there's any report in the literature, but there's been a few cases of trichotillomania. That's chronic hair pulling disorder. Anorexia that Dr. Sweeto had mentioned, and there are probably cases of that where there's not the OCD component, but just pure anorexia. Depression, these kids, once sometimes their OCD and tics resolve, they have huge mood issues that seem to remain, and it's conceivable that maybe some cases of depression can be triggered as well. ADHD, definitely I think this could be triggered, learning disabilities, and psychosis or mania. And this is an interesting title of a paper that dates back to 1961, and it was called Rheumatic Schizophrenia. And this doctor looked at the state hospitals, which were still in effect back then, and found that a lot of the schizophrenics in the hospital had higher rates of rheumatic fever. But she also wanted to point out that she thought that sometimes some of these cases could be rheumatic manifestations, and they didn't necessarily have the history of Sydenham's chorea and rheumatic fever. So she was actually arguing for a pure rheumatogenic schizophrenia type presentation. So we've heard a little bit about microbiome, and this is a really new area, and I don't know if I remember the correct weight, but I think there's something like 8 pounds of bacteria in us. So it has a big role of how we function, how our guts function, our immune systems function. And this is just some of the titles of some of the papers that I think are relevant for PANS, pandas, and behavioral disorders. There have been studies suggesting that probiotics decrease anxiety. There have been support for abnormal flora in children presenting with autism spectrum disorder. There's been some support for using probiotics to decrease the attachment for group A strep in the throat. So this is a really area that I think is going to need a lot more study, but it's definitely connected, I think, in the children that we see with PANS and pandas. And I think we talked about yesterday that sometimes we see these children flare up shortly after going off the antibiotic, way too early to have another infection happen, but it does have a pretty immediate effect on the microbiome of the child. Stress response, and any parent that has had a PANS pandas child knows that it is incredibly stressful. And so one of the things is that a chicken or egg, when you have a lot of stress in your life, are you causing your immune dysfunction to happen, or does the immune dysfunction cause the neuropsychiatric presentation? And I think it is a thing that is hard to sort out, but obviously both are very much at play. What do we know about chronic stress? It decreases the lymphocyte function, it decreases the natural killer cells, lowers the counts of a lot of other lymphocytes, B cells, T cells, and also decreases antibody and complement factors. So you're actually, after having chronic stress, are at a higher rate of or risk of getting an immune and inflammatory condition because your immune system isn't as strong as it ordinarily would be. medication. And I mentioned yesterday, but there's some overlap in the medications that we use for this presentation, that, the antibiotics and the psychotropics may have some overlapping mechanisms. So one of the things I'd like to propose is that antibiotics have actually multiple effects. Obviously, the first one is to treat the active infection, and then you can use it as a prophylactic agent to prevent recurrent infections. Many antibiotics possess immunomodulatory properties, and there are some that actually have some neurochemical properties, and I'll talk about that in a second. There have been antibiotics that were actually developed as antibiotics in the old days, but then they were found to have very significant effect on the behavior and mood of patients receiving these, typically in TB sanitariums, and they actually converted some of these to psychotropic agents. We know that psychotropic agents can also have a lot of immune response, affecting the lymphocyte subsets, and as well as decreasing cytokines that are inflammatory. So this was an interesting study done by Rothstein, where he was looking for a treatment for Lou Gehrig's disease, ALS. And what he did is he mined the FDA-approved database for medications, looking for one that would have an effect on the glutamate transporter. And lo and behold, the beta-lactam antibiotics fell out as being the most strong for having an effect on the glutamate transporter. And the relevance for this is that a lot of neuropsychiatric illnesses are thought to be a sort of a state of glutamatergic neurotoxicity. And so by having this effect on the glutamate transport, you actually lower the glutamate state and decreasing the glutamatergic neurotoxicity. Clavulanic acid, it's a component of augmentin, and it's actually used to overcome the beta-lactamase producing organisms that makes the beta-lactam antibiotic ineffective. There's been some support that it actually crosses the blood-brain barrier and has some neuropsychiatric effects. They were actually studying it for the treatment of depression at one time, just that agent alone. It may relate to changes in dopamine neurotransmission. It may lead to decreased glutamate, and it may have neurotrophic factors, and thereby improving brain protection. And this was actually a very common chief complaint I would get in my clinic at times. My child is addicted to augmentin, and the child would be doing really well. He's on augmentin for maybe several months, and the parents, every time they would try to take him off, he would flare up. And as I said before, it's like it doesn't seem to be necessarily due to a recurrence of the infection. It may be due to immune modulating properties of the antibiotic. It may actually due to some of the neurochemical properties of the antibiotic, because in augmentin you've got the beta-lactam antibiotic and you have the clavulanic acid as well. And then again, it may be some relevance to the microbiome, that when you stop the antibiotic, then you're having a big change in the microbiome at a very short period of time. And as I mentioned, the psychotropics have a lot of immune modulatory properties, and sometimes these are, just in the right direction that the individual needs. Sometimes maybe they aren't. But as I mentioned before, a lot of them were used as antimicrobials in the old days. There are still a few of them out there that have both purposes. And one of the papers that I pulled showing that actually antipsychotics actually decrease the toll-like receptor binding, which is actually part of the innate immune system that starts the whole inflammatory process. And so thereby antipsychotics may have some anti-inflammatory properties as well. That's it. Thank you.